Have you ever stopped to think about what's really going on down there as you get older? I mean, we talk about cholesterol, we talk about joint pain, we talk about keeping our hearts healthy. But there's one conversation that most men absolutely dread having, and honestly, most doctors aren't bringing it up either. I'm talking about what happens to your intimate health after 60. And look, I get it. Nobody wants to sit around discussing this stuff. But here's the thing. Ignoring it doesn't make it go away. It actually makes it worse. I've been practicing medicine for over 15 years now, and I can't tell you how many guys have walked into my office clearly uncomfortable, clearly struggling. And when I finally get them to open up, they say something like, "Doc, I thought this was just part of getting old." And that right there breaks my heart every single time. Because no, it's not just part of getting old. Not all of it anyway. And there's a whole lot you can do about it that nobody's telling you. So today, I'm Dr. Lily Harper, and I want to walk you through exactly what's changing in your body after 60, why it's happening, and most importantly, what you can actually do about it starting tonight. No expensive prescriptions, no awkward procedures, just real practical stuff that works. Let's get into it. So why does nobody talk about this? I think part of it is cultural, right? Especially here in the States, men are kind of raised with this idea that you tough it out. You don't complain. You definitely don't talk about anything below the belt unless it's an absolute emergency. And I respect that mentality in a lot of ways, but when it comes to your health, that mindset can really cost you. I've had patients who waited years, literal years, before mentioning symptoms that we could have addressed in a matter of weeks. And the other thing is, a lot of guys genuinely believe that these changes are just inevitable. Like once you hit a certain age, that's it, game over. But that's simply not true. Modern science and even some good old traditional wisdom give us real tools to maintain comfort, function, and confidence well into your 70s, 80s, and beyond. Now, let me explain what's actually happening in your body, because once you understand the why, the solutions are going to make a whole lot more sense. The big player here is testosterone. You've probably heard of it. It's the hormone that's been running the show since you were a teenager. It affects everything from your muscle mass to your mood to your energy levels. But here's what a lot of folks don't realize. After about age 30, your testosterone levels start dropping. It's gradual, about 1 to 2% per year, so you don't really notice it at first. But by the time you're 60, you're operating with significantly less testosterone than you had in your prime. And that drop affects your intimate health in some very specific ways. First off, blood flow. Testosterone plays a big role in maintaining healthy circulation, especially to the pelvic region. When levels drop, blood flow decreases, and that can lead to issues with erectile function, reduced sensitivity, and just a general feeling that things aren't working the way they used to. Second, there's the tissue health aspect. The tissues in your genital area, just like everywhere else in your body, need good blood supply and hormonal support to stay healthy. Without adequate testosterone, these tissues can become thinner, drier, and more prone to irritation. Some men notice discomfort that they've never experienced before, and they have no idea why. Third, and this is the one that really catches guys off guard, pelvic floor weakness. Yeah, men have a pelvic floor too. And when those muscles weaken, which happens naturally with age and low testosterone, you can start experiencing things like urinary leakage when you cough or sneeze or laugh too hard. Maybe you're getting up 4 or 5 times a night to use the bathroom. These aren't just annoyances. They affect your sleep, your confidence, your willingness to go out and do things. And here's the part that most people miss. All of these issues are connected. Reduced blood flow contributes to the tissue changes. Weak pelvic floor muscles make bladder control harder. Poor tissue health increases susceptibility to irritation and infection. They feed into each other, creating the cycle that can feel overwhelming if you don't know what's going on. But once you understand the cycle, you can start breaking it. And that's exactly what we're going to do. Let me share something with you. A couple years back, I had a patient. Let's call him Jim. Jim was 64, retired military, tough as nails. He came in for a routine checkup and everything was fine on paper. But right as he was about to leave, he kind of hesitated at the door and said, "Hey doc, is it normal to, leak a little when I'm out playing golf?" Turns out Jim had been dealing with urinary leakage, discomfort, reduced function, all of it, for over 3 years. 3 years. He'd just been quietly managing it on his own because he was too embarrassed to bring it up. We started him on some simple changes, the kind of stuff I'm about to share with you, and within about 6 weeks he told me he felt like a different person. Not 20 again, but like himself, comfortable, confident, back in control. That's what I want for every single one of you watching this. All right, let's talk solutions. And I want to start with something that might surprise you. Your diet. What you put on your plate every day has a direct impact on your hormonal balance, your circulation, and your tissue health. Most guys don't connect what they're eating for lunch with how they're feeling down there, but the connection is real and it's powerful. There are certain foods that can naturally support your testosterone levels and overall intimate health. Zinc-rich foods are huge. We're talking oysters, beef, pumpkin seeds, chickpeas. Zinc is absolutely essential for testosterone production, and a lot of men over 60 are mildly deficient without even knowing it. Then there's healthy fats. Your body literally needs fat to produce hormones. Avocados, olive oil, nuts, fatty fish like salmon. These aren't just good for your heart. They're good for your hormones too. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts help your body manage estrogen levels. And yes, men have estrogen too. And as you age, the ratio of testosterone to estrogen can shift in ways that aren't ideal. These vegetables contain compounds that help keep things in balance. Flax seeds are another one I recommend a lot. Just a tablespoon a day, sprinkled on your oatmeal or thrown into a smoothie. They're packed with omega-3s and lignans that support overall hormonal health. But here's the flip side, and this is just as important. You've got to cut back on the stuff that's working against you. Excessive sugar, heavily processed foods, too much alcohol. All of these increase inflammation throughout your body, and inflammation is the enemy of healthy tissue and good circulation. I'm not saying you can never have a beer or a slice of pie. I'm saying if your daily diet is built around processed junk, your body is going to show it, and it's going to show it in places you'd rather it didn't. Now let's talk about something that most men have never even heard of in this context. Pelvic floor exercises. You might know them as Kegels, and I know what you're thinking. Aren't those for women? No, absolutely not. Men have pelvic floor muscles too. And strengthening them is one of the single most effective things you can do for your intimate health after 60. These are the muscles that support your bladder, your bowel, and yes, your sexual function. When they're strong, everything works better. When they're weak, that's when you start having problems. Here's how you do them. Find the muscles first. Next time you're urinating, try to stop the flow midstream. Those muscles you just squeezed, that's your pelvic floor. Now, don't actually make a habit of stopping your urine flow. That's just for identification purposes. Once you know what the muscles feel like, you can exercise them anytime, anywhere. Squeeze, hold for about 5 seconds, release. Do that 10 times. 3 sets a day. That's it. You can do them while you're sitting in traffic, watching the game, waiting for your coffee to brew. Nobody knows you're doing it. It's completely invisible. And the results? They're genuinely remarkable. Better bladder control, often within just a few weeks. Improved blood flow to the pelvic region. Many men report better erectile function and increased sensation. One of my patients started doing Kegels consistently and told me after 2 months that he felt more confident than he had in a decade. And all he did was squeeze and release a few times a day. Pair this with the dietary changes I mentioned, and you're creating a foundation that supports everything else. Let me talk about hydration for a minute, because this is one that flies under the radar. As you age, your body becomes less efficient at retaining and distributing water. Even if you're drinking the same amount you always have, your cells might not be absorbing it as effectively. This shows up as dry skin, fatigue, and yes, dryness and discomfort in your intimate area. A simple trick I recommend is adding a pinch of Himalayan pink salt and a squeeze of lemon to your morning water. The trace minerals in the salt help with electrolyte balance, and the lemon adds vitamin C. Think of it as turning your plain water into a gentle, natural sports drink without the sugar or artificial garbage. It's a small change, but over time, better cellular hydration means better tissue health everywhere, including where it counts. Now I want to get into something that a lot of guys initially feel weird about, but hear me out. Topical care. We moisturize our hands, we put lotion on our face, we use chapstick. But for some reason, the idea of actually taking care of the skin in our most sensitive area seems foreign. It shouldn't be. The skin down there is some of the thinnest, most delicate skin on your body, and it needs attention, especially as you get older. Natural oils can make a big difference. Coconut oil is gentle, moisturizing, and generally well tolerated by most people. It's about as simple as it gets. Rosehip oil is another option that has regenerative properties. It can help restore skin that's become thin or irritated. And if you want to go a more traditional route, sesame oil has been used in Ayurvedic medicine for thousands of years for improving circulation and tissue health. Just a few drops, warmed between your fingers, applied gently. Think of it as the same kind of self-care routine you do for any other part of your body, because that's exactly what it is. Herbal support is another area worth exploring. Ginger, for example, isn't just great in stir-fry. It's a powerful anti-inflammatory that also boosts circulation. A cup of ginger tea in the evening can do more good than you'd think. Maca root, which comes from Peru, has gotten a lot of attention for its ability to support hormonal balance and energy levels. You can find it as a powder and add it to smoothies or even your morning coffee. Chamomile and calendula, when used in a warm sitz bath, can soothe irritation and discomfort in a way that feels almost immediate. I've had patients tell me that a simple chamomile sitz bath was the first thing that actually made them feel relief after months of discomfort. Let me pull this all together for you with a simple daily plan. Think of it as your starting point, not a rigid prescription. Adjust it to fit your life. Morning. Start your day with a glass of water with that pinch of pink salt and lemon. Have breakfast that includes something zinc-rich or hormone supportive. Eggs with pumpkin seeds sprinkled on top. Oatmeal with a tablespoon of flaxseed. Something that sets the tone for the day. Do your first set of Kegel exercises while your coffee is brewing. Midday, stay hydrated. If you're having lunch, think about including some of those cruciferous vegetables or healthy fats. Maybe a salad with avocado and grilled chicken. Do another set of Kegels. Maybe while you're waiting for your food to heat up or during a commercial break. Evening, brew a cup of ginger or chamomile tea. If you're experiencing any irritation, consider a warm sitz bath with chamomile a couple times a week. It takes about 15 minutes, and it's honestly pretty relaxing once you get used to it. Do your third set of Kegels. And if you're using a topical oil, evening is a great time for that as well. Make it part of your wind-down routine. That's it. Nothing complicated, nothing expensive, nothing embarrassing. Just consistent small actions that add up to real change over time. Now, I want to address something directly because I see it in the comments on videos like this all the time. Some people are going to say this is too personal to discuss publicly, that this kind of thing should stay between you and your doctor. And I understand that perspective. I really do. But here's my response. A lot of you don't have a doctor who's bringing this up. A lot of you can't afford to see a specialist. And a lot of you are sitting at home right now dealing with discomfort or embarrassment that you don't need to be dealing with simply because nobody ever told you there was another way. That's why I make these videos. Not to embarrass anyone, not to overshare, but because information is power and you deserve to have it. I also want to be clear about something. Everything I've shared today is meant to complement proper medical care, not replace it. If you're experiencing significant symptoms, persistent pain, blood in your urine, sudden changes in function, please go see your doctor. These natural approaches work best as part of an overall health strategy, and your physician needs to be part of that conversation. But for the everyday discomfort, the gradual changes, the stuff that's just been slowly creeping up on you, the things I've talked about today can make a meaningful difference. I've seen it hundreds of times over my 15 years of practice, and I'll keep seeing it because this stuff works. The beauty of all these strategies is that they work together. Better nutrition supports your hormones, which improves blood flow, which helps tissue health. Stronger pelvic floor muscles improve circulation and function, which makes everything else more effective. Proper hydration supports all of it from the inside out. You don't have to do everything at once. Start with one thing. Maybe it's the Kegels. Maybe it's cleaning up your diet. Maybe it's just drinking better water in the morning. Pick one, stick with it for 2 weeks, then add another. That's how lasting change happens. Remember Jim? The guy who almost walked out of my office without saying anything? He started with Kegels and a tablespoon of flaxseed in his morning oatmeal. That's it. 2 things. 6 weeks later, he was a different man. Not because of some miracle cure, but because he finally had the information he needed and the courage to act on it. That can be your story too. If you found this helpful, I'd love to hear from you in the comments. Tell me what you're going to try first. And if you've already been doing some of this stuff, share your experience because your story might be exactly what someone else needs to hear today. I'm Dr. Lily Harper, and I'll see you in the next one. Take care of yourselves, gentlemen. You're worth it.